Thank you. And it sounds like all the groups were lively because we had a small group to start, but by the end of the session we had a full room and everyone actually contributed. Everyone spoke. So it was a good discussion. We have three priority actions and then one overall suggestion that relates to all three. And the first one is to leverage other ministries besides the Ministry of Agriculture to help implement ASWAP. So Ministry of Education, Ministry of Gender, and Ministry of Health, to work hand in hand with the Ministry of Agriculture to help disseminate and extend best information and best practices for improved nutrition at the farm level. And one specific example of that was the idea of having school gardens and nutrition education within the curriculum of the Ministry of Education at the primary school level to try to make sure that kids from an early age are aware of what the current recommendations are for best nutrition practices, and so that they have some hands-on opportunity to maybe grow some of that food and to make some of that food themselves. Our second suggestion was a mouthful, and partly because what it turned out was many of us had different examples of this approach. And this is to take an integrated, interdisciplinary, and multi-stakeholder approach that involves government, researchers, community members, I believe the word is non-state actors, to do research and extension activities together on nutrition practices, using new nutrition technologies and new practices, but using a participatory or experimental method of trying out these practices. So some of the examples that were brought forward were things like the Farmer Field School approach, or what are called trials for improved practices. That's coming from nutrition. There's Bunda, Dr. Kalambira gave the example of the RDEP, which is Agricultural Research and Development Program, where you have research and community members doing outreach and research activities together on a particular innovation. And then there was an example of innovation platforms, farmer-to-farmer teaching, I can think of an example there, and family nutrition groups or mother groups where you're doing dialogue and trying out new practices at the community level. So in all of those examples, they're using sort of a problem-solving or dialogue-based education model for learning, rather than just transmission of messages. And so in this approach, it's involving households and communities, not only in learning new information, but in developing new information and practices together. So that is all one priority action, because it doesn't work without all those different components together. And then the last one, actually, I think relates to something that was talked about with the second session as well, and that is to support and train community nutrition workers who are primarily trained in nutrition, but integrate broader knowledge from other areas, agriculture, health, etc., gender, and that these be integrated into extension services. But they're nutrition education specialists. And that they have not only initial training, but ongoing kind of refresher courses and support and mentoring. So they're not just given a one-off training opportunity, but they have regular opportunity to get training and support and mentoring, so that they're not just teaching something that is 20 years out of date or no longer considered valid, and that they're getting support for problems they encounter. And I have 1 minute to give my final overall point, and that is to conduct monitoring, evaluation, and research on these strategies to ensure that what methodologies we're promoting and practices we're promoting and technologies actually lead to improved nutrition outcomes. So to make sure that we are staying on top of whether we're getting positive nutritional outcomes from the practices that are being implemented, and we're using sound scientific rigor in doing those evaluation doing those evaluations. And we're not just saying, these have led to improved nutritional outcomes. So thanks very much.